Hello viewers, so today we are going to discuss about certain myths regarding epilepsy. Now epilepsy, as you know, is a condition where people get epileptic fits, and what you commonly know, there is jerking of both hands and legs along with frothing of at the mouth and followed by loss of consciousness. That is the generalized seizures, and sometimes the patients can also have what is called as just jerking of one side of the body, but they don't lose consciousness, what is called as partial seizures. It is a fairly common disorder which we routinely see in our OPD on daily basis, but I know that there are a lot of stigma attached to epilepsy, and also there are multiple myths regarding the disease. So let us look at some of the common myths regarding this condition. So first thing is that people believe that it is a disorder of the mind. So people who have epilepsy, it is a mental disorder, but the fact is that they don't have any mental or psychiatric disorders. It is a disorder of the brain. The second thing what people feel is that those who have epileptic fits, they have lower IQ. So children who get epilepsy, their IQ cannot be normal, and so they cannot do their daily activities, or they cannot do well in their lives. But that also is not true. We have many examples of people with epilepsy who have been brilliant and above average IQs also. So that is not correct. Then the third one is that many people believe that the person's brain get possessed, and that is why it was also called as seizure. So the brain gets seized by some unknown forces like witch or the ghosts or something like that, imaginary characters. And I'm surprised that even in today's world many people feel that way, and so the patients are taken to some traditional or faith healers for this jhad phuk. But that is not correct, absolutely. So that is not correct. And then one more thing which people tell me is that when somebody gets a seizure, we usually keep some metallic object like keys or something in the hand, and if we do that, then the seizures will stop. But the fact is that anyway epilepsy is only episodic, so whether you do something or not, whether you keep something in the hands or not, it is going to stop in the few minutes. So it is not the reason is not that by keeping the keys seizures stop. By nature itself, the seizures stop in the first few minutes. Then there are a lot of stigma and myths about the women with epilepsy, and as a result, many women, when they reach the marriage age, they need to hide this information, otherwise they can't get married. And as per the research studies, women with epilepsy, they take 5 years longer than women who do not have epilepsy to get married. So there is a lot of stigma. And so because this is felt that because women who have epilepsy, they cannot lead a normal married life, they cannot have pregnancy, or the babies will have defect, or she may pass the disease to the next generation. So there are multiple, or they may feel that she is mad or having some mental illness. So all these things are there, but the fact is that a woman who has epilepsy, she can be like any other woman without epilepsy. They can have normal married life, she can look after the kids very well. Pregnancy outcomes can be very good because they are very safe medicines that can be used in pregnancy. So there is no reason to differentiate or look at the women with epilepsy in any different manner than women who do not have epilepsy. Then regarding the men, the myth is that they can't do their jobs well, they cannot excel in their jobs. So sometimes there will be some kind of discrimination in the appointments also. Only thing where there is a risk to the person, like say job of driving or the job of a pilot. Obviously those jobs are not safe for epilepsy patients, but any other job they can excel. Like if it's a desk job, jobs in banking sector, IT, information technology, computer, software, the job of a doctor, lawyer, almost all the jobs can be done easily by any person with epilepsy. So there should be no discrimination in the job sector also. Another myth is that a student who has epilepsy, or a child who has an epilepsy, cannot do well in studies. That is also not true, because we have had children who have been toppers in their schools. They are doing very well in their studies. So there is no reason to believe that children with epilepsy cannot do well in studies as compared to children who do not have epilepsy. So that also is a myth. And then one more thing people feel is that epilepsy is always due to some kind of brain disease. But we should understand that there are many other factors also which can cause a seizure. Like if somebody's sugar drops, so any very low sugar, blood sugar, very high blood sugar, low calcium in the blood, high calcium in the blood, low sodium or high sodium in the blood, they are called electrolyte imbalances. Or sometimes children who are say between 6 months to 6 years of age, they can get seizure just with high fever also, what is called as febrile seizures, and sometimes brain fever like CNS infection, what is called like meningitis, encephalitis. So there are many other causes of epilepsy also, but all the other reasons what I mentioned, fortunately they don't recur many times. So we just have to correct the underlying disorder, and they don't require long-term anti-epileptic drugs. And then another myth or misconception is that epilepsy is always hereditary, which means if someone has epilepsy, they are going to pass it on to the next generation. So it is partly true, it is not fully true. So epilepsy can be familial or genetic or hereditary also, but in many cases it is not family history. So they don't get it from their parents, and so they don't transmit the disease to the next generation also. And then another common thing what we believe is that there is no good treatment for epilepsy, but the fact is opposite. They are excellent medicines which are safe, efficacious, and if the persons with epilepsy take those medicines, they can do very well in their lives, whatever they are doing, whether they are students or housewives or having jobs or anything, they can do well. And they need regular follow-up, and the medicines also are not very expensive. They are good medicines which are quite economical also, and in a small proportion of patients who don't respond to medicines, they are safe and excellent surgeries also which can be done. So I hope that this today you have learned that some of the myths regarding epilepsy have been busted, and you gained some knowledge and information. Please like this video, share it, and also post your comments or queries. I'll be happy to answer. And then subscribe to this channel to watch more videos in the future.